COVID-19 recovery, helping Hoosiers recover financially, physically, mentally, and socially through services provided by Community Action of Greater Indianapolis. Services include energy assistance, child care, family support, education, training programs, and food assistance. COVID-19 recovery.
Hi, and welcome to COVID-19 Recovery. I'm Kelly Vaughn, and I'm joined by the wonderful and brilliant Al Bracken from Community Action of Greater Indianapolis. Hi, Al.
Well, 1 out of 2 ain't bad, and we'll talk about which of the one is correct. Well, maybe not brilliant, that's for sure. But hello, Kelly. Thank you for the kind intro, and welcome to everybody this morning to COVID-19 recovery. I'm with CAGI. I'm on the board of CAGI and involved in a lot of the outreach work that CAGI is doing, a lot of the actually wonderful outreach work that we're doing with the Community Pandemic Wellness Initiative. And our theme with the CPWI is a mind, body, and soul approach to health disparities as it relates to the aftermath of COVID-19. And as part of the MIND initiative that we're doing a lot with mental health, addiction as it relates to COVID recovery, right now, both short-term and long-term as we can see it and define it. And our guest today is Donnell Foster, is the president and CEO of a relatively new recovery network, not just a recovery program, but the Synergy Recovery Network is comprised of practitioners, primary care, a couple of primary care practitioners, recovery houses, initiatives, outpatient therapy, et cetera, et cetera. So with that, and we wanted to bring Donnell on to talk about the Synergy Recovery Network and a little bit about, what Synergy is and what they're doing. And with that, we'd like to say hello to Donnell Foster.
Thanks, Al, and thanks, Kelly.
Hey, how are
Hey,
you?
Donnell, can you tell us a little bit about, from your experience, what you're seeing we can talk about this because Donnell is not a clinical health, mental health professional. He's a young man with a serious passion for recovery. He's had some, in his family, and he wanted to get more involved. Donnell, can you tell us a little bit about what you're seeing in the mental health area and as it relates to Synergy and what you guys are doing?
Yeah, so a little bit about Synergy. We're a level 4 housing and treatment provider, which means we not only provide recovery housing, we provide a bevy of clinical services, everything from intensive outpatient treatment to peer recovery coach, individual counseling, case management, really the wraparound services that someone would need as they're working through their journey of recovery. Particularly during COVID, we're finding a 30 to 40% increase in the drug overdoses locally in Indiana. Now, obviously, from a Synergy standpoint, we don't see that directly, but we are getting more calls from families making referrals for people in outpatient treatment, trying to figure out how to have those conversations with people about getting them in treatment and how can they get therapy and everything along those lines.
Okay. One thing that you just mentioned that we want you to explain to the audience is what a peer recovery coach is and how important that person is for recovery.
Totally. So in 2018, the Indiana Medicaid approved not only reimbursement, but standardization of what they call peer recovery coaches. And peer recovery coaches are people that have lived experience that are trained and certified to work with people that are in recovery. So they may assist them in finding jobs. They're coaching them, they're encouraging them, they're helping them set goals. They're helping them nullify their urges for certain drugs and that kind of thing. They're making referrals out to other places. But, and the funny thing is Medicaid actually now, Indiana Medicaid pays for up to 365 hours a year of peer recovery coach. So as someone that's on Medicaid or HIP, you can get an hour a day for no cost to you from peer recovery coach. And we're finding that people that utilize the coaches on a daily basis, they have a better outcome. Their numbers from the outcome perspective are a lot better because they have someone encouraging them and they have someone that's helping them in their journey to recovery.
Excellent. Talk about and something else you mentioned is wraparound services and how important wraparound services are for your clientele. But explain a little bit to our audience about what wraparound services are and what Synergy is doing to engage with those services.
Yeah, so wraparound services essentially take a bevy of services, everything from clinical and social services, and we provide everything. And I'll just kind of go through some of the lists. You have case management, we have skills training, we have GED classes, nutrition classes, we do supported employment, medication assisted treatment. We do, we assist with medication training and management, everything along those lines. And what that does is a lot of people that have been dealing with addiction are not used to being in a setting such as a regular residence. So they don't have a primary care physician. They don't have a lot of the essential things that a normal person that has been operating and has not been living in active addiction has had, more recently. Not everyone has been homeless, but we deal with a lot of people that have not had a safe place to stay. So when we're coming across people that are referred to us, we like to surround them with services. We like to make sure they get everything from dental care to, again, primary care, making sure that any other physical, mental, and social needs are met.
Excellent. We, the title of the show, COVID-19 Recovery. Can you talk a little bit more, about what your experiences has been with COVID and the precautions you guys are making within your homes, and if you've seen an uptick in or increase in addiction in the general population and the demand for your services?
Yeah, so I mean, one of the things that we're coming across, and we've only been around since 2018, but one of the things we're coming across are a lot more referrals for people that are dealing with not only addiction, but the greater and deeper mental health issues. I read a report earlier that talked a little bit about the fact that there's been a 13% increase in reported or increased substance use among adults in the U.S. So we're very vigilant to the needs of people as they're coming in, but we also have to take precautions. We require everyone that's coming into a home to our residents to get vaccinated. We think it's important to not only protect our other residents, but to make sure our employees are protected as well.
Excellent. Go ahead.
The residents. So are these individual homes, or is it a house that's shared, and are there a number of them? That's really interesting to me in terms of the housing component.
Yeah, so we actually have a series of homes that are certified recovery residences. So what generally happens is you come into the residence and you have a roommate. So there are 2 people per room, and there may be 3 bedrooms or maybe 4 bedrooms, but we have men's and women's beds that are in recovery, and they're individual residences, not a building, but you don't get your own residence, but it is shared. They're shared residences.
Okay.
What does it take to be a certified recovery resident?
That's a good question. So there's a process, and actually NAR, which is the National Association of Recovery Residences, has a set of standards that locally we adhere to. There's everything from the management of the residence to fire safety standards to making sure you have Narcan available for overdose prevention, and any kind of clinical services and that type of thing that you may have, in addition to policies and procedures and any staff that may be required.
Oh, excellent. And I asked that question so everybody would understand that I mean, you not only have synergy there, but the Indiana Association for Recovery Residents is, well, they used to certify the houses, but now DMHA, Department of Mental Health and Addiction, are doing these certifications. And it's important for everybody to understand that these houses or these residents or these programs are out here and they are a resource. And when we think about resources and we think about health disparities, we also want to look at cultural barriers to treatment. And and Donnell, there's a question in there somewhere, but I guess the question to you is, have you seen cultural barriers to treatment, and what has your experience been in reference to who you're seeing coming into your houses?
Yeah, it's interesting that you say that. So there was a report DMHA put out last year that said 90%, I think 90% of the people that use Recovery Works were white, middle-aged men. And you're right, a little bit about Recovery Works. That's a program for people that are dealing with the criminal justice system that also have mental health and addiction issues. So again, we know that there's a bevy of African-American and minorities that deal with the criminal justice system, but for some reason, they are not either getting referred out to recovery housing and the Recovery Works program, or they're not utilizing it. We do have an educational series that travels around the community and talks to stakeholders about making sure there's equity in what they're doing, making sure that they are able to present the options for criminal, whether it's an attorney or someone in criminal justice, present the options to their clients that recovery housing and services are available. We do find, that the majority of people that we serve are Caucasian, but we are educating the community to try to bring those numbers up because we think currently there's a need for education.
Okay. I have a question, but I'm going to hold it for after the break. We've got to take a break. And when we come back, we'll talk more to Donnell Foster about really opportunities for getting help for those who are addicted or dealing with mental issues, especially through this pandemic, when we come back.
During the COVID-19 emergency, community action agencies are open and here to ensure the well-being of families across the country. For over 50 years, we've been delivering life-changing services, solutions, and stability.
Contact your local community action agency serving Boone, Hamilton, Hendricks, and Marion counties for help during the COVID-19 emergency. We can assist with masks, hand sanitizers, food, shelter, transportation, and more. Apply today.
Hello and welcome back. We're here this morning with Donnell Foster, the president and CEO and general manager of Synergy Recovery Network. Donnell, one of the things we were talking about before we went to break was cultural barriers to recovery. And I know myself, having worked in the recovery area for some time also, that I also saw differences culturally with individuals seeking help. And one of the things that we're doing with CAGI, again, with the Mind, Body, Soul initiative, we've adopted a phrase, first things first, with this. And part of that is individuals need to see a primary care provider. Individuals need to see a therapist, and if need be. And we all need access to these services. So you talked a little bit about outreach moving forward. And again, one of the reasons I wanted to bring Donnell on is because Synergy is being innovative in some of their approaches. And as we go through this second segment, we're going to talk about some of the partnering that the Synergy is doing that's very unique and guided toward outreach. So Donnell, what are your thoughts on outreach, and what are you guys doing to reach a different crowd to talk about Recovery Works and what it is and how it is available?
Yeah, so we run a series of community events where we perform drug education seminars, and we also run a battery of tests and questionnaires for people that may be suffering from addiction and or mental health issues. We're working with Community Action and the Tuskegee Airmen on a drug demand reduction program that will enable us to get in the community and hopefully reach people that are maybe not yet have been affected by drugs, but prevent them from being affected by drugs.
Excellent. And one of the reasons, it was kind of a setup for me asking Donnell that, was because of that initiative. Because I obviously, I'm involved with the Tuskegee Airmen and the and CAGI, and we're partnering because one of the things that the Tuskegee Airmen does is outreach when it comes to is youth outreach, and we do a lot of work, and our goal is to do a lot of work with kids to introduce them to aviation careers. So as part of that, as we do outreach, we decided to partner with Synergy Recovery and CAGI to do this drug demand reduction program because it made sense, and it was so far it's been extremely effective. And what drug demand reduction is, I give a brief history on it. It started years ago, and both Kelly and Donnell both are too young to remember when Nancy Reagan did the Just Say No initiative. That was the birth of the federal drug demand reduction program that was run by the DEA. Then it went to the National Guard. And what it is youth outreach and working with kids with team building activities, showing them different ways of having coping skills that will get them away from drugs, suicide prevention, et cetera, et cetera. Donnell with Synergy Recovery decided that they wanted to be a drug demand reduction organization, which I thought was extremely unique in itself. So Donnell, can you tell us a little bit about why you decided you wanted to be a drug demand reduction organization?
Totally. So I think it's one thing for us to assist people that have already been afflicted with the disease of addiction and to assist them in their recovery. But I think for us, if our mission is really to prevent people from ever choosing the life of drugs. And it's a misnomer. A lot of people don't understand that it may be a choice the first time you take a drug, the first time you try something, but it's not a choice to continue taking it. Addiction is not a choice. It really is a disease. So if we can reach out to children and teenagers and reach them early on, and we can have an effect, then the goal would be for us to do that so that maybe Synergy would need to be around in 20 years, or maybe we wouldn't have as many clients that we would need to see or need to care for in 10 years or 5 years.
Excellent. That's a great point that you make. And every time, I'm telling you, every time you bring up one of these points, I'm gonna ask harder and harder questions and get more in depth, because you just said something that at some point in time we'll bring a pharmacist back on and one of our physicians to talk about it. But you hit it on the nail head. And a lot of people don't understand that many times it is not the first time you take a drug, I think is what you said. The first time you take something, whether it's heroin, cocaine, or in some cases for some folks, marijuana, that you make a choice the first time. But with many folks, and everybody is so different, that second time is not necessarily a choice. And that's a great point that you make. And one of the things that we again, because different folks have different tolerance levels for medications. And I've heard it over and over and over and over again, especially when it relates to cocaine, crack cocaine, that the first time they took it, it gave them a high, and they started to seek that high again and again and again, and you never reach that high the next time. So having said that, segueing into talking a little bit more about the effects of COVID-19 and recovery, what have you seen as far as the effects that COVID has had when it comes to referrals and your referral base? Have individuals, and I know you work with a lot of other recovery houses and programs, have individuals been hesitant to refer over to Synergy because of COVID?
No, we're actually not seeing that. Unfortunately, because the demand is so great and because COVID has wreaked havoc on people's mental health and people are drinking more. If they've already were using drugs, they're using more drugs, they're increasing their dosage. And a lot of people are starting anew, trying new drugs. So we're finding an uptick. There's a steady stream. Unfortunately, it would be nice not to have a problem, have to have as many people that needs help. But unfortunately, we're finding that those numbers are steadily increased and we're getting calls daily.
I've always tried to figure out the whole addiction thing. I think part of the reality of it is that life is hard and that it appears to me, yes, some people started because of, just for kicks. And of course, maybe some people because they were on a drug for, to kill pain. But some of it is just a coping mechanism. And I used to joke about it. Maybe it's not funny, but, it's like it never appealed to me because, there's chocolate cake. I mean, you're talking about there's Coke and there's chocolate cake. And I'm thinking chocolate cake got to be better. It surely is more accessible. But then I thought, really, the chocolate cake, that's a Coke.
It can be an addiction. It can be an addiction, totally. Food.
It's the same thing. So whether a lot of times people, well, I'm going to go eat. So we're probably all addicted or dependent on something to help us get through something. And I can find myself sometimes stressed out about something. It's like, I just know, go get something to eat or some chips. It eases the pain. It's a distraction. And so I think that's some of it. So so whether you're addicted to chips or you're addicted to Coke, one is legal and one is not.
Correct. I think one of the things as we talk about, personal experiences and it's something that we all can relate to. I think through COVID, we all at some point in time we were in our homes, isolated, and that's where the increase in self-medication comes into. Instead of maybe having a cocktail at 6 o'clock in the afternoon or 7 o'clock, you start to find yourself taking a sip or something at 12 o'clock in the afternoon and doing things more often than you would normally do it. And the same thing goes across the board with individuals. You have some that maybe never tried marijuana before. And this has been an opportunity because they've been stuck at home to try something different. They reimagine their drug use, or they reimagine self-medicating. So it's not one particular culture, not one particular group, not one particular age group, but I know we've seen an increase across the board in addiction rates, alcoholism, et cetera, et cetera. And Donnell, before we run out of time, can you tell us a little bit about who is actually paying for these folks and individuals that need this help to actually go into recovery and how that works?
Totally. So two things from the housing component. If you are charged or convicted of a felony and you're involved with the criminal justice system, there's a program in Indiana called Recovery Works, and they will pay for housing and they'll also pay for clinical services. Most people that come in, if they don't have insurance, we get them signed up for HIP 2.0 or Medicaid. We make sure they have insurance and we're able to bill their insurance for intensive outpatient treatment, therapy, and a bevy of other clinical services. We also have a scholarship program that allows people that are not involved with the criminal justice system to receive 3 to 6 months of paid recovery housing. And we do that because we recognize that not everyone, even if you don't have a felony or you're not involved with the criminal justice system, you still deserve an opportunity to be in active recovery. And we want to help people in that journey.
Yeah, excellent. The scholarship program. And I want everyone to keep in mind that, again, that CAGI is also participating in that scholarship program. And that's why we're doing this today, because we are a community grassroots organization. And as part of those services, as we do this Community Pandemic Wellness Initiative, Synergy Recovery Network is an integral part in what we do every day. Donnell, tell us real quick, if someone wants to make a referral, how do they contact you?
Yeah, so you can call 317-762-0111, or you can send an email to intake@synergyrecoverynetwork.com. We have counselors and assistants standing by and are available to help.
All right. Thank you for the good work you do. Thank you.
Thank you. Thanks for having me.
All right.
Kelly.
And thank you for joining us here on COVID-19. I'm Kelly Vaughn. We'll see you next time. Bye-bye.
Goodbye.
Bye.
During the COVID-19 emergency, community action agencies are open and here to ensure the well-being of families across the country. For over 50 years, we've been delivering life-changing services, solutions, and stability.
Serving Boone, Hamilton, Hendricks, and Marion counties, be sure to visit our website to learn about employment and education opportunities, food, housing, transportation assistance, and more. Apply today by calling 317-396-1800.
Hundreds of thousands of veterans have taken off their uniforms and put them away, carefully packed and safely stowed. But for some veterans, the uniform isn't so easily removed. The emotions experienced while serving continue to weigh on them. Life after service is different. Many veterans find transitioning difficult. Some feel overwhelmed and lost. But that uncertainty doesn't take away from their strength and courage, nor does it take away from the sense of duty veterans carry with them. The power of one person, one connection, one act of compassion can make a difference in the life of a veteran going through a difficult time. For free 24/7 confidential support, call the Veterans Crisis Line or visit veteranscrisisline.net.
COVID-19 has changed how we spend weekends with the girls. Now it's time to take the first step that lets us get back to brunching instead of late-night munching. Before we can safely come together, we need the facts. As COVID-19 vaccines become available, you may have questions.
Should I get it?
Is it safe? Should I wait?
It's okay to have questions. Now get the facts at getvaccineanswers.org so you can make an informed decision when vaccines are available to you.